Hey guys, thought I'd provide you another update. It's been a week since I last did, and I know I had mentioned a lot of doctor's appointments coming up, and we were still in the middle of deciding on what the new trajectory was going to look like. So I wanted to pass that along to you guys so you know how to be praying, as well as just kind of keep you in the loop as things are progressing. And you all mentioned that you did like this format as opposed to me spending a really long time typing out something. This is easier for me, and I hope you enjoy it too. But trying to keep this more brief, met with had 5 doctor's appointments last week. 2 of them in person, 3 of them were phone consultations, and obviously that's partly because of the COVID situation. But I wanted to quickly walk you through what those looked like and where we're at today and what we'll be doing moving forward. I think the first thing I need to start with is when I had a scan a month ago and we saw progression of disease, 4 new spots in the brain, 2 new spots in the chest, 2 spots currently in the chest growing. The general consensus that was not challenged at that point was this is a new mutation. This is a mutated form of my cancer that is not currently being treated by my daily chemotherapy tablet, which is called Tagrisso. You don't have to remember that, but I take a pill every night. The thought was my current drug isn't treating it. This is new. We have to change therapies. But we've had some good conversations back and forth where that idea is at least challenged. Maybe there's an alternative explanation for what's going on, and as quick as I can, I'll kind of walk you through that. In speaking with my lead oncologist who's in Nashville, we had a good conversation. He called me from his house here last week, and we just talked for a while. And he said, I couldn't believe the news when you texted me and said the scan showed progression. He said, because you're doing so good. What's changed? It was his question. What has changed? You were doing great. What possibly could have driven this new mutation? And, we thought, well, I did the 6 rounds of chemotherapy, carboplatin and Alimta last fall, stretching all the way up to Christmas. And so you go, well, we had a clean scan in November and now this is new in March. Is it possible that the chemotherapy that I did kind of disrupted some type of homeostasis that was going on in my body? Was my immune system, along with my daily chemotherapy tablet, were those somehow working in concert with one another such that my disease was held at bay? And by knocking out the immune system, it's kind of given rise to for it to come back or to grow. The other thing, he said, have you changed any of the alternative things that you're doing? Because he and I have been very forthright and talked about this. He said, has anything changed there? And if I'm being honest with myself and him and you all, but yeah, it has. Because when I did the chemotherapy, the intravenous chemotherapy last year that you guys all, when you think chemo, that's what I did. I was nauseous, I was sick, and the idea of continuing on in a really high fat diet way of eating and all of my supplements and all of that, it was daunting and it was hard because, man, when you're nauseous from chemo, it's like a bratwurst does not sound attractive versus like a bowl of bland rice. And so my carb count went really high and my fat went down. I wasn't doing my fasting. I tried to keep doing my supplements, but I stopped with that because they made me nauseous. I couldn't keep doing my workouts 5-6 days a week because I wasn't feeling great. So if you ask me, did anything change from an alternative perspective? You go, yeah, it all changed there for a couple of months. And then if we pull in the blood work, what we saw in the blood work was, as I mentioned last week, there was a P10 mutation. Well, that was one of 3 things that we saw in my blood work. The P10 in talking to him further, that is not a driving mutation. There's drivers, and then there's these just smaller ones. And this is one of the smaller ones. It doesn't push cancer. It doesn't make it grow. It's a potential that we can use with drugs to fight my cancer in the future if they develop good treatments. There's one in phase 1 clinical trials right now. Great, we'll throw it in the tool belt for later. I mentioned that last week, but it's not a driver. It's not the one in charge of making this disease grow. So the two drivers that we saw were my exon 19, which is my original cancer at diagnosis 3 years ago today, actually, April 13th, 2020. It's 3 years today that I was diagnosed. And then an EGFR amplification. So we saw those two in the blood, but here's what's interesting. We haven't seen those in my blood for the last 2 polls, which goes back about 2 years. So we saw it when I was diagnosed 3 years ago. We haven't seen it for several years here, and now we see it again. Well, that along with the conversation about the chemo and the immune system and my alternative strategy, it's at least created this idea, or this plausible idea. What if this isn't a new cancer? What if this is not a new mutation that isn't currently being treated by your drug? What if this is the same cancer that's always been in your body, but whether it be the alternative or whether it be the chemo and the immune system, something has happened such that it's just started growing again. So that's certainly challenging the idea that we need to just jump ship and go to something brand new. That's not definitive. That's just a plausible, thoughtful idea. So what have we done? Well, I doubled up on my current medication. I have now had 3 weeks on Tagrisso double dose. There was some significant side effects when I first started it, because these are heavy, heavy drugs. I started developing some like neuropathy in my left hand, some tingling, and some skin rashes on my torso and my shoulders, but everything's kind of getting better. There's usually a flare-up event when you add to your medication or you first start it, and it's getting better now. But the idea would be we could push more of it through the blood-brain barrier up into my brain, where we know that there's 4 tumors. And I have been returning to my exercise, my fasting, my nutrition, my supplements. I've been hitting it hard, for a couple of months, post-Christmas and all that. And my immune system's coming back. So rather than just immediately switching to something new, we thought it would be wise to at least give some time to flush out whether or not this theory could possibly be correct. The theory that it's not new, it's the same cancer it's always been, and there was just a lapse. So before we proceed, we want to make sure that that's the case. So the current plan is 1 week from today, I will get another chest CT and a brain MRI. That will have been 4 full weeks since my last scan and a doubling of my Tagrisso, because we want to get more of it into my brain. So when we get that scan next week, if it's a new player altogether that's not being treated by my current drug, then it should be the same or worse in my brain and in my chest. If it is my old cancer and there was just a lapse, then it could potentially be the same or potentially better. 4 weeks is not a big scan interval, so it's not going to be drastic one way or the other, we don't think. But that's what we owed it to ourselves before we just immediately, did a lot of changes to at least test that theory. So what happens if it is worse? We've mapped that out. It's not something that we have to think about or talk about right now. Jennifer and I are so at peace. It's crazy. We're just trusting the Lord through all of this. And it does not mean we're trusting the Lord for my healing. We know he could do that if it is his good pleasure. We would want that. We invite that. But we're not at peace because we're just, beyond certain that God is going to heal me. Can he? Absolutely. Will he? You know, there's a lot of things that happen in this world that make no sense to us. But we believe that there is a God that has a plan, and it is a plan for our good and for a future hope and not for our harm. And where there is a disconnect between what we think is good and what he does, um, that's owing to us, not him. We're the ones culpable, not God. Um, I'm in my downstairs office and there's kids this direction. I can hear them screaming. So where are we at? Okay, so if it's worse, then we have to treat the brain nodules. Not the nodules is in the lungs. Brain lesions. We would have to treat those ASAP. And the way that that would work is we would do stereotactic radiosurgery, SRS, gamma knife treatment to the 4 or 5 that we see in the brain. So we have this all scheduled. Worst case scenario, we get the scan a week from now. It's the same / worse. 4 days later, 3 days later, I'm at the gamma knife facility and I'm getting treatment to the brain lesions. And they would affix a halo to my head with some screws so that it's completely immobile. They'd back me up into a machine and I would get a high resolution MRI of my brain. It would be the most clear picture of my brain we've ever seen yet because I can't move even a millimeter. And they said what will typically happen is 30 to 40% of the time you'd actually see more disease, intracranial disease, than you think you do. So right now we think there's 4 or 5. It's possible we get that scan and there's 7. No big deal. They said for me, with as strong as I am, they'd be willing to treat as many as 15 to 20 in one go. So even if we see 10, we're fine. We're still going to go after it. So that would be surgery. They would do it that day. They'd be ready to go. I think he said it would, if they found 7, 8, 10, I'd probably be in surgery for 6, 7 hours. But we'll keep you guys updated. I'm not worried about it. We'll do it if we need to. And the reason that we would do that to the brain immediately is because we have a clinical trial that we really want to do. It's U31402 is the name of the trial. It's a novel approach. It's a good program. My doctor's excited about it. He wants me to try it. He thinks I would do great on it. So that's, without giving you tons of details right now because we don't know which way it's going to go. That's the plan. The plan is to test this theory of whether or not cancer is new. Is it a new mutation that we have to go to something else, or is it the old mutation that I've always had and there was just some lapse? So here's what I would say to you, and I'll close. We're at 13 minutes. I'm going to shut this down at 15 minutes because I don't want to do another 30-minute one like I did last time. I am praying that the Lord would accomplish his perfect will in this situation that lends him the most glory and us the most good. And I am offering up this situation to him to do as he pleases. You would think that based on how I've lined this out for you, that it should be obvious that I would be praying for the fact that it's a good scan next week, that the brain lesions are smaller or even gone, and that the lung is better, and that we don't have to change therapies. You would think that duh, that's what we're praying for. But you know what? The Lord is doing such a work in my heart, and this is my wife's heart too. This is not just me, and I know you guys said you want to get her on here, and she's agreed to, so we're working towards that. But we're just holding it really loosely. We are praying more, God, you have a plan, and we can trust you no matter what. And so yeah, would it be great if it was a better scan and we didn't have to leave my current drug, that it was kind of a false alarm, if you will? Sure. But do we have faith that even if it's a worse scan and I have to do brain surgery and go to a clinical trial, Yeah, we do. So that's how I'm praying. That, I'm not going to correct anybody if you go, man, I'm just praying for a good scan and you don't have to leave. I won't. You pray that prayer. That's good with me. But I think it's just helpful for you to know where we're at, that we're praying more for, whatever gives the most glory to God and whatever is his best plan for good in my life and others' lives. That's truly what we want. And we'll see. We'll see in a week. We will see which direction we're going to go. Is it possible that there's a middle ground where it's like there's no changes? Maybe. I don't know. We'll cross that bridge when we come to it. We're at 15 minutes, 30 seconds. Now you guys know what's going on. You know how to pray. I love you. God bless. We'll talk soon. See ya.